Hi, welcome to You and Your Health. I'm your host, David Bertone. Today's topic is something near and dear to my heart. It's the physical therapist as the practitioner of choice. We're going to talk today about issues that I deal with every day as a physical therapist and find out some of the things that the consumer can have access to that would improve their life in terms of their health and well-being. Our guest today is Ken Maley. Ken is a licensed physical therapist and the executive director of the New Jersey Society of Independent Physical Therapists, also as a partner in Maley & England Consulting in Wayne, New Jersey. Ken, thanks for joining us.
Thanks, Dave. Glad to be here.
Ken, tell us a little bit about your background and what you currently do.
Well, I've been a physical therapist for 25 years now. I can't believe it's that long. And as you mentioned, I'm a partner with with Barry England, who's another physical therapist, in a consulting firm where we consult with other physical therapists, insurance companies, etc., regarding physical therapy issues. In that 25 years of practice, I've done a lot of speaking to consumer groups, senior groups, running clubs, etc., gymnastics clubs, about physical therapy, the services that we provide, and along the way have kind of encountered some misconceptions now and then, in the course of those conversations, and I hope that maybe we might be able to clear up some of those misconceptions.
Exactly, and I hope we can do that. And I think it's best if we start off about talking about who are physical therapists and what are some of the common things that we treat.
Well, I think what a lot of people don't realize in the public, when they hear physical therapists, they may have some preconceived notion of who we are and what we do, and it helps, again, I've found in speaking to the general public, if we educate them about what our preparation is and what our education is in becoming physical therapists, it helps them get a better picture of who we are in the healthcare system. Mm-hmm. As you know, we spend a lot of time in studying the human anatomy and spending time in the anatomy lab, something that a lot of people may not always be aware of when they're learning about physical therapists. Taking a lot of the same courses that physicians will take, and sometimes taking some of those anatomy courses, for example, alongside those physicians. Mm-hmm. So we have a very good, strong education in the human body and the study of anatomy. And in using that knowledge, there are a lot of ways that we can help people overcome injuries, illnesses that they may encounter during their lives, whether it's something as simple as a sprained ankle or a twisted knee or just a painful back from something that they may have been doing over the weekend. These are all types of things that physical therapists will see on a routine basis and that we can help the public with.
Now, when you talk about the education level, what are the entry level for a physical therapist these days?
Well, at this point, all physical therapists graduate with a minimum of a master's degree, anywhere from 5 to 6 years of college education, including their professional education. It depends on the program that they've gone through, but they'll graduate with at least a master's. Many are actually beginning to graduate with doctoral degrees, and they graduate as a doctor of physical therapy. Does not make them a medical doctor. It does not mean that they treat the same things that medical doctors treat, but they enter into the field with a doctor of physical therapy degree. And as I said, all of the programs around the country now are master's level, at least.
Now, would you say that the education is kind of targeted for what we do as professionals? It teaches us how to treat conditions that people have.
Exactly,
right?
Exactly. And the way that I like to explain it to the layperson, to the general public, is physicians tend to treat those very conditions. They'll treat the fracture. They'll treat the broken bone. They'll treat the person that's had a stroke, but by treating the stroke itself. Whereas what we're educated to do and what we actually do is treat what those things have done to the person. Mm-hmm. So we kind of treat the consequences of that disease or that injury, of that fracture, for example. And that's what we spend our education learning, is how to treat those conditions. And again, whether it's something as severe as a fractured bone, or if it's something as simple as just a little sprain or strain, they're all things that we are educated and prepared to treat.
Now, the consumer typically will think about rehabilitation when they hear the word physical therapy. Absolutely. But we also do prevention and some of that stuff. Can you talk a little bit about that?
Absolutely. Rehabilitation is probably something that we spend a lot of our time doing, maybe even the majority of our time, certainly. It's probably what most people associate physical therapists with. But as you said, absolutely. Prevention, what we call primary and secondary prevention, meaning trying to prevent something happening the first time, or if someone unfortunately has had an injury, well, can we prevent it from happening again? And that's what we would call secondary prevention. And in fact, we also do things such as palliative care that people are certainly familiar with, and they might think of things like just helping to relieve pain, even though you may not completely eliminate a problem. If we can help that person manage that pain better, or perhaps even eliminate that pain, that is also an area that we concentrate in. It's part of our scope, as we call it. Mm-hmm. And another area that you didn't touch on, but we certainly are involved in, are in things like fitness and conditioning and sports improvement, performance improvement types of activities. Whether it's learning how to hit a golf ball further, or how to hit a golf ball without injuring yourself, or swinging a tennis racket. These are all things that physical therapists are educated to do, and that we're certainly qualified and capable of helping the public with.
I think you bring up a good example about the golf, because in my practice, I treat golfers all the time, and I'd rather get them before the injury. And I'm not looking at their swing in terms of changing how they hit the ball. I'm looking at the way their body performs the swing, and improve that, and then that improves their distance and accuracy, et cetera.
Absolutely. You're not looking to try to take them from a 20 handicap to a 10 handicap.
I'm not a golf pro, but if I can improve the way they use their body, that may be possible.
And maybe you actually prevent that real handicap
That's correct.
from coming about.
Now, you brought up fitness and exercise, and the public or consumers these days hear a lot about personal trainers. Mm-hmm. Now, why should a person see a personal trainer, or maybe they should see a physical therapist first in some conditions? What's your thoughts about that?
Absolutely. I couldn't agree more. I mean, I think one of the advantages that we really offer to the public is, people will sometimes refer to the medical model. And what, again, the public may not always realize is, even though we've talked about some of those fitness types of activities, swinging a golf club, etc., we are actually in kind of a unique position in healthcare, where we will often treat patients along with another healthcare provider. We may often refer people to another healthcare provider, either to work with us at the same time in treating that patient, or maybe we've identified something in that patient that needs to be addressed, that, all respect to personal trainers, their education doesn't prepare them to interact that way directly with the public, where ours does. The ability to recognize a problem that might be serious, or might at least require some additional investigation. So, in essence, we do think that we should be the practitioner's choice, as you said at the outset, that the public is probably better served by seeing someone with our education and our background rather than a personal trainer.
Good. Now, one of my biggest pet peeves is this term direct access, which was passed in 2003, which allows the consumer a direct route to see a physical therapist, except consumers don't really know about it.
No.
And I thought maybe we'd go back in terms of the history of this direct access and talk a little bit about how this took place and how it helps the consumer.
Well, and it's a subject that's near and dear to my heart, because I worked very hard on trying to help get that law changed back in 2003. We've been licensed in this state for 25 years, and prior to 2003, despite what a lot of people may have thought, there really was not the need for someone else to see our patient before they came to see us, because, as we've said, our education prepares us to examine them and make sure there's nothing serious with their condition or needs anyone else to be involved in their care. But even though that was the case, there was still a law that required that consumers see a physician before they came to us. Well, that was changed in 2003. Now the person can walk right in off the street and come and see you in your office, or any physical therapist. And if you identify after examining that person that there's a problem that you can address right then and there, you can go right ahead and do it. The law perfectly allows that to be done. If there's a need for you to perhaps involve someone else in their care, you make that decision right then and there when you see that person. But a lot of people still are under the impression that they would need to see a physician first before they come to see a physical therapist, and that's just not true.
I think it creates a problem with the entry into the healthcare system. People will look to other practitioners because ease of entry. And they still think that the consumer needs to see their doctor first before they, when they sprain their ankle, they need to see their doctor, they hurt their back, need to see their doctor. And really that's not true. And I think the problem comes in is that insurance companies still have this kind of grip on the process. Can you talk a little bit about that?
Yeah, absolutely. Well, as we said, the legislature recognized in 2003 that the law should be changed, that the consumers should be able to directly access our services as physical therapists. But unfortunately, the insurance industry has been kind of dragging their feet to follow the lead of the legislature. And oftentimes they will still require that policyholder, that subscriber in that insurance plan, still see someone else prior to coming to see us, which is, I think we would say, is kind of unfair, and certainly is not what the legislature intended when they changed the law in 2003. And they were pretty specific about that. If anyone is so inclined, they can go back and take a look at some of the comments that the legislature made at that time, where they said they wanted to make sure that the public had full and unrestricted access to the full scope of services that we provide. And we obviously agree with that and would like to see all consumers have that same access, not just those who might be willing to pay cash for it, but those who have insurance that would cover our services, hopefully.
Now, what role do you see physical therapists playing in the healthcare system in terms of working cooperatively with other medical professionals, and how this direct access law would tie in with that?
Right. Well, one of the concerns that we will sometimes hear, and I think it kind of relates to the question that you're asking, people will think, well, gee, isn't this possibly some kind of safety concern? You guys can't treat everything. You've said you don't do surgery, you don't use medication or inject people, and that's all very true. However, as a healthcare professional, we're in, as I said, kind of this unique position where it's part of our education to refer to other people, and actually it's required under our law as well, that if you do see someone off the street and you have a concern that they may need to see a specialist, an orthopedist, a neurologist, a podiatrist, whatever the case may be, or a dentist for that matter, you actually are required by our law to make that referral. Or even if it's just a consultation, to check with care that they may be receiving from another professional. Could be an oncologist, for example. We have a requirement to actually work with that other professional, and we think that's perfectly appropriate. We think that's how all healthcare should work. So we fit very well into a real system of operating. We're not looking to be out there on our own and practicing independently, but not alone, not as a single entity, but part of an entire system.
Yeah, when we talk about the practitioner of choice, obviously we're also, entry into the system for some people. Some people may come to us for the first time, and then we may pick things up in which we refer to other practitioners. Right. And I think that's another benefit for the consumer. But there's also some safeguards in place for this system. So we do have this direct access, and patients can come to see us directly. What are some of the safeguards?
Well, I mentioned one is this requirement for referral if we identify some problems that are outside of our scope or something that we're not educated to treat. And a perfect example comes to mind, I think, of something that I experienced personally myself in treating patients. That I was treating a young man who was about 21 years old who had been in a car accident and had dislocated his shoulder. And as we know as physical therapists, it's not uncommon to then see those patients have a problem with that shoulder continually popping out. Some of your viewers may be familiar with this themselves. And among the things that we'll do for those kinds of patients is perhaps try to strengthen the muscles that will hold that shoulder in place better. That's not unusual for us to see. However, in this young man, what was a little different about him is during the course of my treatment of him, he was complaining of pain that just didn't fit the picture, and especially pain that he was feeling at night, at rest, that he couldn't relieve by putting his arm in any particular position. It wouldn't subside. And unfortunately, he was kind of a stoic kind of kid, so getting information out of him was tough. But with a little bit of probing, I came to realize that hearing these things like pain at night, pain that just will not be relieved by any physician, we know as physical therapists that's what we would refer to as a red flag, as a warning sign of a possible more serious problem. And in his case, unfortunately, it was a much more serious problem where he had a bone cancer and wound up having his arm amputated. It's a terrible story, but it's an example of how we work within the system.
Very good.
I wouldn't just go and treat the young man without involving someone else. And he was properly managed, not with the result we hoped for.
Yeah, but you were able to pick it up.
Right.
Well, I think after the break, we'll come back and talk about how this direct access can be effective for the consumer and how the physical therapist can truly be the practitioner of choice.
It's springtime in the forest of the black-tailed deer. The young male is feeling playful. It's time for tag. The female flicks her ears. Her way of saying, "Catch me if you can."
Welcome back to You and Your Health. I'm your host, David Bertone. Our guest today is Ken Maley, a licensed physical therapist and the executive director of the New Jersey Society of Independent Physical Therapists. We're talking about physical therapists as the practitioner of choice. Ken, we talked about the issue of direct access for the consumer in the first half of the show. Let's talk a little bit about the problems that the consumer faces really accessing our services.
Right. Well, first and foremost, and probably the biggest, is the problem of insurance and what insurance companies may require. As we mentioned earlier, the legislature made it pretty clear in 2003 as they wanted the public to be able to directly access our services. However, many insurance plans, and probably most insurance plans, will still require some type of referral prior to allowing their subscriber, the patient, to access our services. And that's a requirement that they'll have for coverage. That certainly presents a barrier for the person that, again, wakes up in the morning with that pain in the neck that they had from sleeping the wrong way overnight, and the person that perhaps has some problem after gardening over the weekend. The ability to come in and see us right then and there when they have the problem is they're facing some barriers because of the insurance requirements that insurers will put in place.
So it makes it hard for people to come in. I mean, they want it easier. They pay for this insurance. Sure. They want to be able to utilize it. And here's an instance where they wake up, they have neck pain, they want to come see a physical therapist and feel better that day, and their insurance company that they pay big money for is going to require them to see a physician, which then kind of starts the process of anti-inflammatories, maybe an MRI. By the time we get the patient, it's 3 weeks later, it becomes a chronic condition.
Absolutely.
So it doesn't improve access for the consumer. I know you want to talk a little bit about coverage and what insurance coverage is.
Right.
I know an event took place at the end of April. It was the Cover the Uninsured Week.
That's right.
And can you talk a little bit about how that's important in this scheme of things?
You know, we hear a lot of talk in this country about the fact that we have so many uninsured, probably close to 50 million people now without insurance. And so you had an event last week, the last week of April, called Cover the Uninsured. And we feel, the New Jersey Society of Independent Physical Therapists, feel that, well, perhaps we need to have a week that's entitled Cover the Insured. Because what we're finding with the patients that manage to get their way through the process of actually getting to us for treatment, getting that referral, getting in to see the doctor, et cetera, going through all the hoops that they have to jump through, only to find out that the coverage that they thought they had was probably really not available to them. That most people would probably assume when they hear that their problem is covered, that their insurance will cover them until that problem is resolved. And as we unfortunately find out once we start treating these patients, that's often not the case.
So give us an example of that. Somebody gets injured, they're recovering from the injury, they have, say, 30 visits a year in their policy
Right.
to see a physical therapist.
Right.
What are some of the barriers that consumers are facing?
Well, that works great if all you need is 30 visits to get better. But you know, depending on the severity of someone's problem, again, in a minor problem, 30 visits may be ample. But God forbid someone has a very serious problem. That 30 visits will often not be enough, and especially if they're unlucky enough to get injured at the beginning of the year, and they use up their visits by the end of February, well, now they have a problem. They better hope that they stay healthy for the rest of the year. That's one of the more common barriers that we see. And unfortunately, on top of that, then those are just kind of the policy limitations that people will have.
Let's talk about the inappropriate utilization of those visits.
That's the other.
So now you're going to have an insurance company tell you how many visits of those 30 you can see,
right.
And then, well, we only need to get you 80% better.
Right.
We don't need to get you back to where you were before.
Right.
That's an issue of coverage.
Oh, absolutely, absolutely, it's a coverage issue. Again, people I think assume that when they're aware that they have coverage for physical therapy, that they're going to be covered until they recover. And that's not the case. And as you mentioned, there are some companies out there that specialize in not only making it difficult to access our services, but then limiting those services tremendously. And the example that you cited, sometimes even saying, well, we're going to cover you until you're 80% better. That may be great if you can function at 80% of normal, but unfortunately, most people have to function at 100% of normal. And as we've tried to explain it to people, if you're trying to recover from that fractured leg, you better hope that you're not late for the bus, because your insurance company's not going to cover you to be able to run for that bus, only to walk very slowly. We don't feel that that's really appropriate coverage.
The problem is that most consumers aren't aware of this until it's too late.
No, they're not.
So we get them in our office and we have to advise them that this is the situation, right. And then now they're very upset and they fight with their insurance company, but at that point it becomes very difficult and it becomes a financial issue for them.
Sure.
And quite often we'll see people with very large co-pays and their insurance pays very little. Can you tell us a little bit about that scenario going on?
The dollars and cents can be very disturbing. We're actually seeing insurance policies now where the patient's portion of the bill is actually greater than the insurance company's portion, which we really find mind-boggling, really. You wonder who the insurance company is in that case. That's as I said, kind of the dollars and cents of it, as you mentioned, the financial obligations that the patients will take on, whether it's a deductible that's extremely high, or in that case, a co-payment that's actually greater than what the insurance company will pay. We feel that that's really an unfair situation for anyone to allow, and that it certainly doesn't represent what most people would be considered to be, what most people would consider to be coverage.
And once the consumer finds out about that, I think they start getting involved, but
Sure.
They need to know it beforehand.
Absolutely.
Now you mentioned the New Jersey Society of Independent Physical Therapists, and this group has started working on changing this situation.
Yes.
and to update us as to what's happening to fix these problems and improve access for the consumer.
Well, we actually have been working with Assemblyman Neil Cohen on a piece of legislation that's Assembly Bill 2123. And this is an attempt to kind of balance the scales a little bit better and ensure that, well, we are responsible for treating our patients and for doing things that are appropriate and necessary for them and not doing things that are unnecessary. We want to make sure that insurance companies likewise are upholding their responsibilities to their subscribers by covering necessary services, appropriate services, and covering them at a rate where they don't wind up shifting the majority of that financial responsibility to the patient, because again, that makes us question really who has the insurance here. Mm-hmm. And there is a bill that is moving its way through the legislature, as I said, A2123. And we are very hopeful that this bill will, as we said, kind of balance the scales and assure that the public who thinks they have coverage really does have coverage, and that the legislature will allow them to have that access that they intended.
So I think what I understand of this bill, there's three main components. There's the ability to have true direct access for the consumer, so the consumer can see us directly without the need of a referral, where the insurance companies now may require that, even though the legislature didn't intend that. It would also create a fair reimbursement schedule, where therapists are going to get a certain level of reimbursement, and we'll be able to tell our patients what that number is.
Absolutely.
And then it's also going to define what what is necessary coverage for their physical therapy services.
That's correct.
Okay,
That's
so
correct.
can you talk a little bit about that? And
Yeah, I think a lot of times when people hear the reimbursement side, they may think that, oh, gee, it's all about money. That's what we think about in healthcare. I mean, our concern is, again, really that we have an obligation to our patients, and we have to provide a certain level of service. And if there's not reimbursement to support that level of service, someone's going to lose out. And our concern is we want to make sure that it's not the patient that loses out. They require a certain amount of professional service from us. It's important that we make sure that insurance plans will allow for and cover that professional service so that, again, the consumer is getting what they're entitled to and what they need. You mentioned removing those barriers to access, which is something else that the bill will do. Allow that person who legally can come to see you to have their insurance company cover that visit, as they should and as the legislature intended. And as you said also, the issue of coverage, making sure that the coverage is not just at the convenience of the insurance company, is not just for the financial benefit of the insurance company, but they are really required to cover necessary services that that person needs to recover, whether it's to get back to work, or get up the stairs, or get out of bed in the morning.
I think it's important that you bring up that consumers need to have this access, but they also need to get the provider needs to be paid a reasonable amount, because in our field in physical therapy, we can't see a patient for 2 or 3 minutes.
Right.
It takes 45 minutes to an hour to provide care, so that's really important for that to happen.
Absolutely.
Let's talk quickly about what is not physical therapy, and this kind of prepares the consumer what to look for when they're looking for a physical therapist.
Absolutely. Well, I'm sure you've had the experience yourself when we ask patients that come to see us and we ask, have you had physical therapy before? And they say, yes, I have. We ask them to describe it, and they talk about things that sound an awful lot like going to the gym. Sounds like a gym program. And we ask, what was the name of the therapist that you saw? And they can't remember. Those are kind of warning signs for us. If you are under the impression that you're receiving physical therapy, we want to make sure that you're seeing a physical therapist. Ask to see their credentials. Ask to see their license. Make sure that you are actually being treated by a licensed person, because that makes sure that that individual is accountable to the state to help protect you as a consumer, and that you're not being subjected to a service that you think is actually physical therapy when in fact it's not, because the person who's rendering the service to you is not a physical therapist.
And I know the Society of Independent Physical Therapists, they have a position on the ownership of physical therapy.
Yes.
Can you just briefly talk about that?
Well, we feel very strongly that it is important for consumer protection to assure that the person that actually owns the clinic that you are being treated in is in fact a physical therapist and not a layperson, someone with no license, because again, it offers another level of protection to the public, that you know that the person who is benefiting and profiting from that service is someone that's subject to state regulation. If it is not a licensed person, there's an argument that that person can basically do whatever they want, because they're not accountable to the state as you and I are. And we feel very strongly that's an important consumer protection that should be maintained.
Great. Well, Ken, thanks for joining us today. It was really a pleasure having you
pleasure.
here. And you've been watching You and Your Health. Today's topic was physical therapist, the practitioner of choice. You heard that the consumer does have direct access for physical therapy services. Those people out there that require the services of a physical therapist should seek those of a licensed physical therapist. Thanks again for joining us. And again, I'm your host, David Bertone.